Good morning. Thank you very much to the NHS Fab Academy for giving Kent and Medway Prehab project team an opportunity to present our work, the challenges we faced in response to COVID-19 pandemic, and how we've risen to those challenges. My name is Tara Rampal. I am the Clinical Director of Kent and Medway Prehab, and I shall request the rest of the team to introduce themselves.
I'm Claire Mallet and I'm the Programme Lead for Living with and Beyond Cancer, or Personalised Care and Support with Kent and Medway Cancer Alliance.
I'm Alison Weller. I'm one of the counsellors providing therapeutic support.
I'm Chris Ford. I'm a project manager in Medway Council in the Public Health Directorate.
Hi, I'm James. I'm a physical activity instructor specialising in prehab, working with public health in Medway Council.
Thank you. So Kent and Medway Prehab is a multi-pronged program which is for optimization of functional capacity, nutritional intake, and emotional resilience of patients before, during, and after their cancer treatment. This project was started as a pilot project in Kent and Medway NHS Foundation Trust. We launched the service in 2018, and it was a hugely successful pilot, resulting in nominations for us being finalists in HSJ Awards and winning the Perioperative Care Success Pathway Award and visits from Secretary of State for Health. We also published the importance of prehabilitation and population health and the impact of patients who suffered from cancer but had other metabolic diseases such as diabetes who received very positive outcome from them. We have our own patient steering group, and we use their guidance and direction for defining how the service progresses. As we were thinking on how to increase the geographical access of our service from a hospital-based pilot to community sites, we were struck by an uninvited guest in the form of COVID-19. The access of patients who suffer from cancer to services was limited. Being vulnerable, they were advised for shielding longer, which curtailed their physical activities, and on occasion there were delays to the cancer treatments, which presented a very unique challenge for the patients and for us providing care for around the patients. We at this point conducted a Delphi consensus looking at the global expert opinion on digitalization of prehabilitation. While 100% of all the service leads across the globe agreed that we needed to digitalize prehab, there wasn't much idea or consensus on how we should go about it, because no one had done this, and this was a very unique challenge that the pandemic had brought home to us. So we present our journey, which first and foremost meant coming together to form a website, making referral to our service, as well as engagement within the public and the healthcare professional groups easy to be able to refer and offer the service to everyone else.
Yeah, so when we started out, obviously I was working initially face-to-face with the clients in the local satellite centres. So in local community gyms where bases, helping taking them outside of that hospital environment. Once lockdown was coming into place, we quickly sort of took that transition of how we could go virtual and continue our sort of service to the patients. That was the main priority to us. As Dr. Rampal said, she completed the survey and we got sort of brilliant results back. So from there, we prepared our video and the nutritional information, so we had something to supply to the patients. And it was key to us. As I say, it was a way to allow us to continue with the patients we were already in contact with, so we weren't losing them. And then obviously it allowed us to take on the new patients despite the conditions and safely. There were some drawbacks we were a little bit worried about, obviously not being face to face. It's harder to monitor people, get the response on how they're taking the training, if it's effective enough. So we had to make sure we stayed quite basic initially. And then as you're talking to them, we could change that sort of exercises as we were going and the level they were working at, etc. Obviously they were the drawbacks though, but we found sort of as we progressed there were so many benefits. Number one, it meant we could go from just providing to the Medway patients to the whole of Kent. It gave us access to everyone. which was key to sort of, we were sort of doing a minimum of 2 calls a week with our patients, some more if they needed that extra help. We would always arrange it around, and arranging it around their working schedule or their schedule was key as well. So some of them it has to be evenings, others you'll do a call on the weekend if they're busy. But that regular contact made a big difference to the patients because they felt like you were always there. It also, from our point of view, it meant that we could continue our treatment during the quarantine period. So for us, the virtual contact was also vital during the quarantine periods that was being applied to the patients prior to their surgery or treatment beginning. They were having to go into complete lockdown, which if we were face-to-face would have meant we had to stop 2 weeks early. So being able to continue virtually made a big difference. Also, the rapport you built by continuing.
Hello, yes, this has been a fantastic opportunity in a way, and after getting over the therapeutic challenges of offering telephone support, for example, unreliable technology, issues around confidentiality and privacy, and of course the vital clues around body language and facial expressions that are so important for the counselling process. We found some fantastic benefits, and in liaison with Roberto and James, we've provided a really rounded service, I believe. And of course, some of the benefits that James has spoken about have been, you know, the patients have been in the comfort of their own home. And once we have established some confidentiality and privacy and boundaries around the work, we've been able to get over some of those challenges. And a really big one is issues around transport and parking and payment for parking and having enough change. Of course, from home, all of those issues have faded into the background. And again, flexibility around time has been brilliant. We've had no missed appointments because we've been able to provide quite a bespoke service. Eventually, we were able to offer a choice of phone or online service. Some of the patients are gradually coming online. We've had more, we in actual fact have had more phone contacts. And of course, the accessibility, and people are feeling unwell and not very able to get around. They haven't had to make an extra journey to come and find us. I think this has been, whilst it did provide a lot of challenge in the first place, I think we've found a really good and collaborative way of working together.
It's quite scary getting a cancer diagnosis and knowing that you're about to have major surgery, and I was quite nervous about what I could and couldn't do. Could I keep doing Pilates? Was it safe to run? What should I be eating? All of those questions James was able to answer and really kind of reassure me and encourage me, and basically talking to him, I knew I was doing the right thing, and that really motivated me to keep going and to sort of up those fitness levels where I could. Even though I was already quite confident and quite fit, the programme definitely increased my confidence at a really crucial time.
I was contacted a few days after my cancer diagnosis asking if I'd like to join the Prehab programme. I said, yes, I'll do anything I can to beat this thing and get as fit as I can to deal with it. And I'm certainly very pleased that I joined. I've been very well supported during the whole thing.
So I definitely recommend it. It's a very good programme and a very good crew.
So in here what we show is the map of Kent. As James said, that the moving to the virtual delivery allowed us to reach all across the county. So this is the map of the whole Kent, and we also have London, and we can see the distribution of the different referrals, where they are coming from. So we can actually reach all the different areas, starting from Medway. You can also find us now in the cancer care map, where we are listed as one of the services provided for cancer patients. We also wanted to assess the psychosocial impact of the intervention. So we measured different aspects like anxiety, depression, the loneliness the patients were going through, and the enjoyment of the physical activity. And we could actually prove that the virtual intervention that we were carrying out was as effective as the one we did face-to-face before COVID started.
So you've heard all about the program, and a great team has been assembled to deliver a really positive experience for our patients. And the future is also bright, we feel, for Prehab. We currently have a brilliant website, kentandmedwayprehab.org, where you can find out all about our program. It also mentions our preprint sessions. These are sessions that are delivered to our patients in order to reach a wider audience, perhaps in groups. If you're a health professional, you can also come along and listen to those and see exactly what our program entails. The future, as I say, is bright. We feel that the Prehab program sits very well in the Medway Public Health Directorate. That's a real unique feature to the program, is that we are so closely linked with public health and the onward journey of our patients. We refer to it as prehab to rehab. So what we're trying to make sure we do is provide people with an onward journey in terms of health improvement, so that we're not wasting that opportunity that we have when people are in remission from cancer. We can link into many different public health services, such as quit smoking, alcohol moderation, our healthy weight programs, and general healthy lifestyle programs, which are so popular in the community.
The Cancer Alliance has been really pleased and proud to support and fund the Prehab service, which we think exemplifies personalised care and support in the way that it delivers tailored interventions based on need to support patients as they get fit for cancer treatment. It's a service that feels very aligned with long-term plan recommendations and expectations in terms of improving patient experience, quality of life, improving health inequalities, and also very much, as mentioned, around that personalised care approach. And it's a very personable service. It's a very dynamic team that has already evolved from delivering in an acute hospital to moving out into the community, aligned with public health, adapted rapidly in the pandemic to deliver virtually. So we feel it's a really exciting service. We're really pleased to support it and are looking forward to seeing it develop further.
In a nutshell, it has been a very challenging time for the entire world, and particular for the health and care sector. We are very grateful that we were able to be supported by Cancer Alliance and Public Health to help develop our service and make it accessible, make it flexible, and make it pandemic proof for the future. So these are the different ways that you can get in touch with us. We again thank the NHS Fab Academy for allowing us to present our intervention. And if you have any ideas, any suggestions, we look forward to collaborating with you. Thank you very much.